All right, so we are going to finish the rest of the vital signs lecture. We talked about blood pressure already. We talked about pulse. Now we're going to focus on respiration. Just a reminder, you guys will have a lab on this tomorrow, so just make sure you're paying attention to this part so that there is no confusion. So what is respiration? Respiration is just the more medical way of saying breathing. And so you have two different components to respiration. You have your inspiration and your expiration. Sometimes it's also called your inhalation and exhalation. But just know that when you're inspiring or you're inhaling, you're bringing oxygen into your body so that your cells can use it to function properly. And then when you are expirating or exhaling, you are then removing CO2, which is a byproduct from breathing, from your cells, and then again, continuing that process. So just know that one respiration includes both of those components. So one inspiration and one expiration. General guidelines for normal rates. So for somebody over the age of 15, normal respiration is going to be about 12 to 20 breaths per minute. So if you are younger, you tend to actually have more of a higher rate of respiration, and a lot of that, and even animals. So if you have like a small dog at home, a small cat, they breathe much more rapidly than humans, and that's just because due to their size, they're not able to produce as much of an efficient breath than a human. And then people who are more conditioned, so in better shape, they tend to have lower respirations, which that just means their lungs are able to produce that oxygen, have that gas exchange, and work more efficiently than somebody who is not as in shape. So it's very similar to how pulse can be affected as well with exercise. Respiratory patterns. So why am I talking about this? If you plan on working in the medical field, respiration indicates the function of your lungs, and it also helps to indicate the function of your heart because the two work together. So you have different what are called respiratory patterns, and you can think of them too as ranges, but the first type of pattern of breathing that I want to talk about is abdominal breathing. So this is often called belly breathing, but this just means that if you are breathing from your abdomen, that is the primary muscle that you are using to breathe. So little background on breathing, you use your diaphragm, which is a muscle that sits underneath your lungs, to actually cause breathing. And so if you're breathing from your belly, then you're able to engage that muscle, that diaphragm, more efficiently, and then you're able to breathe more effectively. You have what is called apnea, and this is when you are not breathing. It can be where you're not breathing for a period in time, or it could be that you're not breathing at all. So when we get into CPR, one of the very first things that you need to check when you have somebody who potentially needs CPR is whether or not they are breathing. If they have apnea, which is that no breathing, then that would indicate that you need to perform CPR. Bradypnea is below 12 breaths per minute. So what that means is it's very similar to bradycardia. Somebody is just breathing less than 12 breaths per minute. And again, that can be more common in athletes. Shane-Stokes respiration is another pattern. So tomorrow in your lab, you're going to basically tell me whether or not you have one of these various breathing patterns. Shane-Stokes is a breathing pattern that typically happens from a traumatic brain injury. So tomorrow, if you see that term, I do not hope anybody says that they have Shane-Stokes respiration, because that would mean you have some type of serious brain damage. But what it is essentially due to that trauma to the head, it affects the ability for your body to control its respirations properly. So you're actually going through periods of time where you're not breathing, so your body's not getting that oxygen. And then you're also having periods of, rapid breathing and also slow breathing. So it's very, very abnormal. Dyspnea is when you have difficult or painful breathing. It's typically called shortness of breath. So a lot of COVID patients right now probably are suffering from dyspnea. You have tachypnea, which is anything that is above 25 breaths per minute. So normal is 12 to 20. If somebody is in between that 20 and 25, they don't technically have tachypnea. They're kind of like an in-between. But this is breathing that is faster than normal. So hyperventilation, if you know what that is, if somebody maybe you've known has hyperventilated, or maybe yourself has hyperventilated, just know that the medical way of saying that too is also tachypnea. You can have what is called labored breathing. So tomorrow in your respiration lab, you guys will be moving around a little bit at home. Labored breathing is typically what you might experience if you just exercise really hard. So you're not breathing just from your belly. You know, your shoulders are moving. You're trying to gasp for air. Your neck muscles might also be contracting as well. So it's kind of like your whole chest is expanding, trying to get as much oxygen as you can. But you can also have labored breathing if you are suffering from shock, if you're hyperventilating, maybe from stress or an anxiety attack. So again, labored breathing can be not a bad thing, but then it can be too if it's related to a certain type of medical condition. Next thing we're going to focus on is your core body temperature. So core temperature is important for you to understand because your body has a very, very narrow range that it needs in order to function properly. So if you don't know what the normal body temperature for a human is supposed to be, but it's 98.6 degrees, typically people will start to experience symptoms of a fever even as low as 99 degrees. And that is just because the range for it is so minimal. And so it's just important that if you notice somebody to have a high temperature due to maybe an infection, an illness, that you're not just, not thinking that that's important. And then I just have examples up here. You don't have to necessarily write this down, but just know that the medical term for a low body temperature is going to be called hypothermia, which I'm sure you're aware of. And then opposite of that, if you have a high body temperature, that is hyperthermia. And so with hypothermia, there are various causes for this. Obviously, they can be weather related, which these two are examples of. But with hyperthermia, if you think a fever, that can also be something that's considered hyperthermia. And then with hypothermia, you can actually have a decrease in your core body temperature from things like hemorrhaging, so bleeding too much. So again, it's not just related to you being outside in the cold or the heat. Medical conditions can also affect your body temperature as well. So like I said, normal core body temperature is 98.6. In a healthcare setting, they will check somebody's core body temperature typically through a rectal thermometer. So that means they are taking a thermometer and they are putting it up someone's bum. I was taught in athletic training that I need to do the same if I suspect an athlete from having some type of heat-related illness. I am not going to do that just because of the fact that I'm dealing with minors typically. So if I suspect that somebody has a really high temperature, I'm just going to call 911. But just know in a healthcare setting, they will be checking typically through the rectal or rectum. And then just know that depending on where you are checking temperature, so oral, which is your mouth, maybe armpit, which is axillary, or even rectal, there's going to be varying differences in degrees. Rectal is the most or the best, like the gold standard, because you're actually inserting it into someone's actual body and you're getting a more accurate reading. Yes, when you insert it in the mouth, you're doing the same thing, but the mouth can also have heat from other sources. The last thing we'll talk about are just some additional vital signs. So pain level is another type of indication for somebody's vitals. So pain is usually measured. You would tell the person 0 to 10, what is your pain level? I use this in athletic training, but I also know that it is not very accurate, and that's just because people have different pain levels. So somebody might say that they broke their arm and their pain level is at a 3 versus somebody might say they stubbed their toe and their pain level is at a 10. So you kind of just use it to get an idea of what their pain is, but I wouldn't also just solely use that as my source. Skin color can tell you too about somebody's state or condition. So if somebody is really red, you might think that maybe they do have a temperature, or maybe they're having some type of heat-related illness. Pale or ashen might mean that they're actually going into shock. So we'll talk more about this when we get into first aid, but they're not getting adequate circulation. And then blue would be that cyanotic color that we've talked about previously. So same thing, they're lacking oxygen and their circulation is compromised. You can also use pupils as a indication for vital signs as well. So your pupils are supposed to basically get smaller or constrict with light and then get bigger or dilate with lack of light. So if I think somebody has a head injury, I'm going to be checking their pupils. And if their reaction is not normal, so let's say I shine a light into their eye and their pupil stays the same, or maybe it even gets bigger, which it's not supposed to, then I might, assume that the person has some damage to their brain. State of consciousness. So we'll talk more about this again when we get into first aid. But if somebody is unconscious, that is never normal. So if somebody is unconscious, that's going to indicate that there's probably issues dealing with their nervous system. If somebody is having difficulty not being fully present, then that's going to indicate something as well. And then the last one, your strength and sensory changes. So this is just if there's any nerve damage. So if you've ever had a physical exam before, they typically will check to see how strong your muscles are, and then also can you feel certain things. So those are the primary vital signs that we use in healthcare. And like I said, we will have a lab going over respiration tomorrow. So just make sure you guys get these notes done, turn them in by the end of the period, and we will talk about this more tomorrow. Bye.